Thank you, Drew. Continuing on with the theme of what's new in digestive diseases, our next speaker will be talking with us regarding anticoagulation, which is basically an explosive discovery thing, because it seemed to me every 6 months we could have a new agent on the horizon. And as a gastroenterologist, as a healthcare provider in GI, I'm sure everybody would understand, there's nothing that would cause more palpitation to us than a patient on anticoagulation. So to help us understand this complicated topic is Dr. Abraham. She's not new to us, but what she's doing is so new to the GI endoscopy part and gastroenterology practice. So please help me welcome Dr. Abraham.
Good morning, and thank you to the course directors for inviting me to speak with you today. We are going to cover a fair bit of information in 20 minutes, so I hope a lot of this information will be new to you, because every time I give one of these lectures periodically through the year, either locally or at a national or international course, there's new information. So this should keep me busy until I retire in 10 years. So, learning objectives. We're going to cover a fair bit. Specifically, we're going to talk about anticipating the risk, because in cardio GI clinic, our motto is the best defense is a good offense. If you can prevent the first GI bleed from occurring in these patients, the patient has a much better outcome and lifespan. We're going to talk about special at-risk groups that you may not be aware of: the elderly, those on combined antithrombotic therapy. In this neck of the woods, we see a lot of patients on drug, dietary, and herbal supplements, and they have important interactions, and the hepatorenal group of patients. I'm going to show you one very impactful slide on the impact of risk prediction scores, and we're going to talk about management paradigms that are changing and evolving essentially every 3 to 4 months. So I'm glad you're here today. The first thing about anticipating the risk, this is not a nuisance side effect. I know a lot of my friends in cardiology would like to think it is, but luckily we've been working with the cardiologists at the national level since 2008, and they are now appreciating that when a patient has a GI bleed, whether it's related to anticoagulants or alone or in combination with antiplatelet agents, these patients have a shorter lifespan, and I'm talking within 1 year. So you can see that the risk of complications associated with AFib and ACS patients is very, very